to now introduce our next speaker, Gordon Folks. He is the founder and CEO of Archer First Response Systems, pioneering integrated sUAS emergency first response to combat sudden, sensitive, life-threatening emergencies. And Gordon will be presenting the next generation of life-saving infrastructure. So Gordon, take it away.
Awesome. I appreciate the intro, and it's great to be here with everybody. Let me see if I can share my screen here. Well, yeah, so as stated, my name is Gordon Folks. I'm the CEO and founder of Archer First Response Systems. Just as a little precursor, sUAS is an acronym that stands for Small Unmanned Air Systems. Lay term is a drone, but we really like to stick with the the specific definition here. So I've been working with drones or unmanned air systems since 2012. I founded Archer First Response Systems in 2014 with the goal of really improving time-sensitive emergencies. Cardiac arrest has always been our North Star. It's a very acute, time-sensitive situation that has a rather effective remedy, but that remedy is only effective within a small time window. And so our goal with Archer First Response System is to help equip municipalities with kind of this next generation of life-saving infrastructure that can help facilitate the immediate delivery of those medical devices to help improve the outcomes of time-sensitive emergencies like cardiac arrest. Just briefly about me, I graduated from Florida State University here in Florida in 2016 with a degree in economics and a certificate of competency for the utilization of unmanned air systems within emergency management. So anytime I have an opportunity to kind of present and talk about kind of our mission and what we're doing with the kind of latest in technology and infrastructure to help facilitate this, I like to take a moment and really drive home why we're focusing on cardiac arrest and use the opportunity to hopefully share some education about the ailment here and what it really means. So one distinction that it's really important to make is that cardiac arrest and a heart attack are two very separate things. This may be rudimental education for some of you guys, but I'd like to just cover the basics here. A heart attack is a clogged artery, prevents blood circulation because of a blockage in an artery. Cardiac arrest, however, is an electrical issue with the muscle of the heart. I kind of make the comparison. It's almost like having a Charlie horse in your heart. It's a bit more complicated than that. There's a lot of other, rhythms and additional details that go along with it. But just as a general idea, it's kind of just like your heart locking up, really. Your heart going into what's called fibrillation, which is basically a fluttering state of the heart where it's not effectively pumping blood through the body. Causing hypoxia in the brain, a lack of oxygen, which then leads to death extremely quickly unless you can kind of stop that fibrillation and get the heart back into a regular rhythm. So to accomplish that, there's a lay rescuer tool called an automated external defibrillator. Many of you may be familiar with these devices. You might see them on the wall at your gym or in the airport. Or sometimes just spread throughout a community. But basically, an automated external defibrillator will apply a high voltage shock to the fibrillating heart, completely stopping it. And then your brainstem or your body will naturally bring your heart back into a healthy rhythm. And ideally, you can get that shock in a quick enough time where there's no brain damage and there's definitely, ideally, not a loss of life. But so why we're focusing on this issue, one is the time sensitivity of it, and some of the modern infrastructure available today really opens the doors to kind of a new paradigm in treating cardiac arrest. But also it's just a substantially large problem that I don't think gets as much coverage or attention as it should. There's about 365,000 episodes of non-traumatic EMS assessed out of hospital cardiac arrest annually. And 90% of those events are fatal. So we're looking at around 326,000 fatalities annually from cardiac arrest alone. It's also one of the leading causes of death in student athletes. No one likes to see a young, healthy athlete suffer from cardiac arrest and not have access to a defibrillator. But unfortunately, often that's a very common situation. And finally, there is, in fact, a lay rescue or device, the automated external defibrillator that can be used by anybody to help stop that fibrillation and bring the heart back into a healthy rhythm. Defibrillators are very straightforward to use. They basically just have two pads and leads that go into a high voltage battery. You apply the pads to the chest of the victim. You can kind of see in this image here of the defibrillator where the pads get applied. The device will read the rhythm of the heart, and if the heart is in a shockable rhythm, it will allow a shock to be applied to the victim. So you can't hurt anybody with a defibrillator, as it won't allow a shock if the rhythm is a non-shockable rhythm. But you certainly can help save somebody's life if you can apply one of these to somebody quickly enough. So I know in that slide I said there's 326,000 fatalities annually, and numbers are, it's nice to hear, but to actually help paint that visualization, this is a county that we're working with in Florida right now. This is a year's worth of their data, specifically on cardiac arrest calls. All of these blue pins were cardiac arrest calls within a 1-year period. So every single one of these dots that you see, there's about a 90% chance that it was a fatality. So it's a substantial problem, and you'll see similar spread of cardiac events throughout any populated area. It's about 1 in 1,000 people annually will die from cardiac arrest. So if you have a population of a general city or a suburban area that has 50,000 people, 40,000 people, you can expect at least about 40 fatalities annually. So the existing paradigm for cardiac arrest prevention and defibrillator implementation is usually by implementing publicly accessible AEDs. And this is, for now, this is kind of like the best method of doing this. And basically, the idea is buy as many defibrillators as you can, spread them as far and wide as you can. So that way, if somebody has cardiac arrest, they're more than likely going to have it near one of these devices. That paradigm is fairly expensive because you have to buy thousands and thousands of defibrillators for a particular area. It's rather labor intensive because you have to upkeep each one of these devices. And at the end of the day, you still have to cross your fingers and hope that you're going to have cardiac arrest, or whoever the victim is happens to have it nearby one of these publicly accessible AEDs. And even if they do, the lay rescuer has to be aware of where that defibrillator is, must have the cognizance to leave the victim or have somebody else with them go and find this defibrillator, bring it back, and then applying it. And just to kind of reiterate, this is the current paradigm where we're seeing about a 90% mortality rate and about 326 deaths annually. It is reasonable to note that there may not be as widespread of defibrillator coverage as possible right now. But even with the given number of defibrillators that are out, which is a number higher than it's ever been, and with this paradigm, we're still seeing a fairly high mortality rate. So exists now infrastructure that enables kind of a paradigm shift here. And that's kind of why I titled this presentation, the next generation of life-saving infrastructure. So we use these unmanned aircraft systems to help transport, defibrillators directly to 911 callers. And a lot of times when, we're talking to people about what we do, the focus really gets on the aircraft itself, just kind of the drone itself. And people assume you just strap a defibrillator onto a drone and you just fly it out to somebody, like but there's a lot more infrastructure required to actually facilitate that deployment and the operation of those aircrafts 24/7 and to fly directly to a 911 caller within an effective time period to make sure that you can actually have a positive impact on the outcomes. So I've listed some of the kind of core technologies that we utilize to actually put together a usable, deployable infrastructure for municipalities to help decrease the response times. Satellite imagery nowadays, with the cost of getting to orbit substantially lower than it's ever been, thanks to SpaceX, There's more and more companies that are launching satellites into space that are able to produce high fidelity satellite imagery constantly. So we're able to use that infrastructure to help understand and analyze relevant geographical areas to our installations. Further, widespread LTE connectivity. It's something that I think all of us kind of take for granted because it's kind of been around the past 10 years or so. But we all kind of have access to the internet whenever and wherever we want on our phones. But that widespread LTE connectivity is kind of what's been pushing the IoT industry forward and really enabling remote monitoring of infrastructure and of edge devices, whether it's your smart lock at your house or your air conditioning unit, or all the way down to life-saving drone deployments. Cloud computing has become a norm across technology industries. It really gives the little guy, it gives startup companies all the way to massive scale companies the access to highly secure and redundant and infinitely scalable compute resources. And coupled with abundant APIs for various different data sources, whether it's weather information or flight traffic information, or really anything, it kind of allows smaller companies to have access to these resources and also take advantage and utilize a ton of different data collected by other companies for other different reasons. GPS equipped smartphones is again something we probably take for granted, but is something that we have in our pockets every day. And this has a huge impact on 911 call outcomes because now with new technologies and advancements in computer-aided dispatch softwares, 911 call centers are actually able to get the GPS coordinates of your device when you call in. So the level of accuracy to the location of the caller has gone from 10 to 50 meters in any given direction to down to like a meter. So you're able to really understand where a particular victim is when they call 911 because of this kind of proliferation of GPS-enabled smartphones. And finally, kind of the sexy, cool part of all this, the drone side of it, there's been insane advancements within the unmanned air system realm, even over the past 5 years. The hardware, all the way from brushless motors to speed controllers and power supplies, have been iterated on for years at this point and are getting to a point where they're extremely reliable. There also exists open source software, namely the PX4 flight control stack. It's an open source collaboration with a global community that's helping develop the software for autonomous flight in stable multi-rotor fixed wing and vertical takeoff and landing unmanned aircraft. And unmanned air systems themselves are starting to become a standard as a tool for law enforcement, EMS, and other industries. So I guess the socio-cultural side of unmanned air system, our drones, is slowly starting to become a bit more commonplace than they have been in the past. So this is starting to seem less like sci-fi and more like something like, why isn't this here yet? So all of this kind of opens the door to a new paradigm of defibrillator transit and treating cardiac arrest and other time-sensitive medical emergencies. So what we do is, we use this satellite imagery to help identify acceptable locations where we can actually make a life-saving delivery. So you can see in this image, we have delivery coordinates marked in every driveway and up and down public roads. We do this at scale. We do this across 35 square mile chunks of counties. So that includes soccer fields, baseball fields, golf courses, roads, neighborhoods, pretty much wherever there's an open 5 meter clearance to the open sky, we can make a delivery to. Well, we use this widespread LTE connectivity to help us constantly monitor our aircrafts while they're in flight. We also use it to monitor them before and after flight. So it really allows us to deploy an asset and track it and manipulate it and control it remotely from anywhere in the world, which really allows kind of the offloading of some of the labor side of managing these aircrafts and the flight operations off of the particular county or particular user, and allows our company or really anybody else to help monitor, maintain, and ensure these vehicles are safe to deploy and are healthy. On the cloud computing side and kind of on the API side, it really allows us and other companies to ingest really sensitive and important data that we use to verify whether or not it's safe to deploy these aircrafts. So namely, that's air traffic, temporary flight restrictions and advisories, hyperlocalized weather conditions, the aircraft's health itself, whether or not the sensors are healthy, and a bunch of other very useful tidbits of data that really help us determine whether or not it's safe to deploy these aircrafts. Again, kind of offloading some of the labor associated with these operations. We're able to understand an environment live 24/7 and can make automated decisions whether or not it's safe to deploy an aircraft. For example, if we see sustained winds over 17 miles an hour, the risk to reward ratio of that operation might exceed what's acceptable, and therefore that system will be taken offline and not deployable until we see the winds die down. And the same thing can be said with precipitation and a bunch of other variables. Finally, advancements in unmanned air systems. From parachute recovery systems in events of catastrophic failure, which you can kind of see on the left as a video of some of our parachute testing, all the way through, as I said before, to kind of the motors, the speed controllers, the flight controllers, even the props these days. We work with a company called Free Fly Systems, and they make really excellent hardware. Even down to their props are they can flex and move to help reduce vibrations in flight. So there's a lot of iterations, as I said, that's gone through all the various different aspects of unmanned air systems to really get them to a point where they are reliable, athletic, and safe to operate. So the new paradigm that we're really working to implement using all these kind of technologies put together is less of a scatter AEDs all over the place, but instead provide blanket coverage over particular geographical areas that these aircraft can respond to in a quick amount of time. So each one of these green circles in this video, for example, is 35 square miles of coverage area, and basically what each one of these systems can cover in under 5 minutes. So the average delivery time of each one of these green circles is 2.5 minutes, and the longest delivery time is 5 minutes at most. And so this is another county here in Florida where all of the pins are cardiac arrest events. So it kind of gives you an example of what this coverage can really do and what the impact can be if implemented properly and broadly. So what's possible with systems like this? So this on the bottom here is a video of one of our installations in a county in Florida. And our goal is to really increase access. So ensure that anybody that needs an AED can get one no matter where they are. So kind of circling back to the GPS-enabled smartphones, we're able to really understand exactly where that person is and use that information to help us identify which delivery location is going to be most appropriate for that caller. We also are working to decrease response times, having the athleticism of these vehicles to really fly quickly along straight lines, over infrastructure, over traffic, directly to a victim in need. Is a huge benefit and has a really big impact on the overall response times to these particular events. So as I said, each one of these systems has an average response time of 2.5 minutes. And with cardiac arrest, it was on a previous slide, but I didn't really mention it. Every minute is about a 10% likelihood of fatality without defibrillation. So if you have an average response time of 6 or 7 minutes from ground-based assets, that person will end up with maybe a 30% chance of survival. But being able to, on average, get out there in 2.5 minutes, really, we're sitting in that 70 to 85% likelihood of survival for these events. And finally, kind of the overall goal really is to help prevent cardiac arrest fatalities. So if we're able to, running these things at scale, have this type of impact where we're decreasing the mortality rate down to 30% instead of 90% where it's at today, we have the opportunity to save 217,000 lives annually, and this is all just based in the United States. So one other aspect of what we do and what these systems are useful for and capable of is helping with opioid overdoses as well. Opioid overdoses are also a time-sensitive emergency where there is a lay rescuer device that can help counteract the overdose, namely naloxone or the brand name Narcan nasal sprays. It's something that anybody can use. It's just a squirt in the nose, and it helps counteract and reverse opioid overdoses. So we're also carrying Narcan in these payloads as well to help EMS providers more quickly respond to overdoses as well. So that's kind of the end of the presentation here. My goal is to really just kind of show that all of the infrastructure that we have today is really making us primed for a paradigm shift on some of these time-sensitive emergencies. And some of them, specifically cardiac arrest, have such a hard impact to our general populations across the entire country that they're really worth paying attention to and doing the best that we can to implement these technologies to help prevent these fatalities and improve outcomes. So I'll stop there, and that's about all I have.
Thank you so much for that wonderful talk. And it's really so exciting to know that around 200,000 lives could be saved. That's tremendous. I mean, really and truly. So thank you for this great presentation.